Welcome to Beyond Diagnosis, how physicians counsel patients on living well across specialties. In this podcast, we learn from the experts how all specialties practice preventive medicine. This is geared towards medical students who spend countless curricular hours learning the disease model and how to treat sick patients. This is a supplement to help us improve the lives of our patients by promoting optimal health and well-being, addressing the root causes of many conditions. My name is Michelle Omega, fourth-year medical student hoping to one day be a family med doc. And today I have the honor of being with our expert in pulmonology and sleep medicine, Dr. Grewal. Welcome, and thank you so much for being here, Dr. Grewal.
Thank you. Thank you for having me.
So first, the formalities. Disclosure, this is for educational purposes only. Please see your doctor if you have any concerns about your health. Second, Dr. Grewal, I just wanted to confirm verbal consent to publish this episode.
Absolutely, yes.
Let's get right into our introduction. Dr. Ritu Grewal is Associate Professor of Medicine at the Sidney Kimmel Medical College of Thomas Jefferson University in Philadelphia, the Fellowship Director for the Sleep Medicine Program, and the Program Director for the Jefferson Sleep Center. She went to medical school at All India Institute of Medical Sciences and graduated in 1984, completed residency training in internal medicine at Long Island College Hospital, and subsequently completed fellowship training in pulmonary disease, critical care medicine, and sleep medicine at Columbia Presbyterian Medical Center and North Shore University Hospital. Her current research focuses on sleep issues in women and sleep-disordered breathing. And from my own personal experience, she is an excellent teacher. She was my small group facilitator for a couple months, I think in first year of medical school. So nice to see you again, and thank you for being here.
Yes, sure. It's great to see you again too, Michelle.
Just to start off, could you tell us broadly what conditions you treat?
Any sleep disorders, sleep apnea, sleep issues in women, insomnia, narcolepsy. There are a lot of sleep disorders that can occur, dream enactment behavior. So there are a lot of sleep disorders, and I treat all of them.
And what does your typical week look like?
I am involved a lot in education also. So my typical week, I will see patients in my clinic, about 20 hours or so of direct patient care. And then I teach, like I was with you, the Sidney Kimmel Medical College, the first year. I'm still a CBL facilitator. Up until I took on my new position, I also was providing pulmonary care for patients with ALS. And then, of course, we have a lot of trainees who go through our sleep program, our sleep fellows, our pulmonary fellows, medical students, residents. So I'm involved a lot in that teaching also, and then running the sleep center also.
So when you're in the clinic, what are the healthy lifestyle habits or behaviors that you counsel your patients on in your field in particular?
Okay, so in terms of sleep, I think the important things is one, to recognize the importance of sleep, right? We are meant to sleep 1/3 of the day, and there are very important physiological changes that occur in our body when we are sleeping. So the most important thing is to counsel patients on the importance of sleep, right? Give yourself the opportunity to sleep. Realize the importance of getting 7 to 8 hours of sleep. Keep a regular sleep-wake schedule. Don't have a big difference between your weekday work schedule and your weekend schedule when you're not going to work, because that upsets our internal clock. And then to promote a good environment for sleeping, avoid electronics in bed. That's really, really important, okay? Avoid caffeine before going to sleep, because that can promote a light sleep. Alcohol also significantly affects the sleep architecture. Those are the important things in a broad sense that we want to counsel everyone on sleep.
Could you go a little bit into, you mentioned the physiological impacts of sleep on the body?
Yeah. So when we go to sleep, there are a lot of changes that occur in terms of slowing down our heart rate, slowing down our breathing. And there are a lot of hormonal changes that occur also when we go to sleep that affect our appetite, especially the first 2-3 hours of sleep is what we call deep sleep. So we're going through these different stages of sleep. And the most important is what we call that deep sleep. It's not REM sleep, it's deep sleep, where really is what these changes are occurring and what we need to feel refreshed and alert the next day. There are a lot of changes that occur in the body, and we really need those changes to be healthy long term, especially when it concerns changes in the hormones, like our appetite promoting hormones. People who are sleep deprived tend to have these changes where they tend to eat more, or it has these changes where then one tends to gain weight. Or the blood pressure, people who are chronically sleep deprived, their blood pressure goes up, their risk for diabetes goes up. So getting the proper amount, the quantity and the quality, both are important.
Thank you so much for shedding light on how sleep is affecting many organ systems, like the endocrine system with hormones and the cardiovascular system with heart rate and blood pressure. And when you counsel patients, do you have any particular strategies or goals when you're trying to help them actually implement these changes in their real life?
Well, a big part obviously is counseling, right? But then you
Mm-hmm.
also have to realize that there has to be some inbuilt flexibility. There are a lot of people who have kids at home who are working two jobs, right? And so I may counsel them that, hey, you need 7 to 8 hours of sleep, but it may not be realistically possible, right, for them to do that. So you want to have some flexibility built in so that you can counsel your patients to get better, right? It doesn't have to be perfect, right? So, for instance,
Mm-hmm.
if somebody says, I live in a neighborhood where there's a lot of noise, there's a lot of, light, and I'm scared, I live alone, I'm scared to sleep alone, I need my television on to drown out the noise. And because I live alone, I feel scared. Well, then, okay, then I have to say, fine, have your television on, or maybe have some sound and some light, a night light, some soft music on, that helps you, right? Or like my mind is racing, right? So I can't take away the mind. Well, try to read a book or listen to an audio book or a podcast to get your mind away. So I think what we have to do is, as physicians, is go to where the patient is. Try to have that empathy that you are understanding their environment, their lifestyle, and then try always say, I'm trying to make it better. I'm not trying to make it perfect. And I think when you meet
Mm-hmm.
the patient there, that helps a lot for the patient to go along with you to some extent.
Yeah, absolutely. Like that flexibility and giving them concrete objectives and concrete actions, like you said, reading a book or giving them examples, solutions to help them. And then my next question is, what specific health markers or metrics or indicators you use to evaluate their sleep health, for example? Like, are there any labs or tests you do, or is it more like survey questions every visit? How do you evaluate that?
So there are really no labs to assess whether somebody having healthy sleep, right?
Right.
There are surveys, there are questionnaires we can use. There's something called the Epworth Sleepiness Scale Score, which we use to
Mm.
assess their level. It's a subjective level of sleepiness. However, I think the best way is to ask the patient, right? How do you feel during the day? What is your day like, right? Do you feel sleepy and tired that you need to take a long nap, right? And then you can go into what is the reason why they are so sleepy and tired. So just asking that question, hey, my day is going fine. I don't feel the need to take a nap, right? I feel good during the day. And well, then you're probably doing the right thing for the most part. But then you can go a little bit more into detail, look at their sleep schedule. People get used to like feeling a certain way. They sleep 5 hours at night, but then they just get used to feeling the way they are, or they have a lot of motivation and they can drive themselves. Then it's a question of educating them to say, you know what, try to get another hour of sleep. See how you feel. Maybe you might feel a little better. But I find the best thing is to go into their sleep schedule, their sleep environment, their work habits, their family life, and ask them how they feel during the day.
Mm-hmm.
It's not how you feel when you wake up, it's how you feel during the day. The rest of the day
Okay.
is important.
And what's your opinion on needing a nap during the day? Should someone who has had adequate sleep during the night not take a nap during the day, or
Yeah,
can
so
can
I
that
think
be split?
Yeah, so if you're getting adequate sleep at night, you really shouldn't have the need to take a nap. However, there is what we call a slight circadian dip in the afternoon when these alerting influences in our brain, which are kind of controlled to some extent by sunlight, we have a dip in the afternoon. And I always say, look, if you feel the need to take a nap, by all means, take a short power nap, right? 20 to 30 minutes. Set an alarm on your phone so it wakes you up. And then it can help you for the rest of the afternoon and evening. You don't want to take a nap late in the evening. I think a nap in the afternoon, a power nap if needed for 20 to 30 minutes only. Because if it's a long nap, then it prevents your ability to sleep at night. And then that's not good because our bodies, our brain, we are meant to sleep at night.
And how do you explain to patients how unhealthy sleep hygiene physiologically impacts the brain or the body?
I will explain to them about what are the different stages of sleep that we go. Most people think we just close our eyes and our brain is kind of somewhere else, and that's not the way it is. We go through these different stages of sleep, which is light sleep, semi-deep sleep, deep sleep, and we cycle into REM sleep. And then we have 5 or 6 of these cycles at night. So let's say if you have a lot of disturbance in your background, right? Light, sound, high temperature, that will cause you to be more in those light stages of sleep from which it's easy to wake up, right? So that's one way of explaining sleep hygiene. Then the other is the effect of alcohol. Alcohol disturbs the sleep architecture. It may help you go to sleep, but then alcohol disturbs that sleep architecture. And when the alcohol level goes down, then you may have a prolonged awakening at night. And then it suppresses REM sleep and then it rebounds REM sleep. It can make sleep apnea worse. Those are the ways I try to explain to them the effect of caffeine. If you have caffeine close to bedtime, then that's going to reduce some of the levels of those neurotransmitters. And I don't use the term neurotransmitters with them, but those substances in our brain that are helping us go to sleep. So caffeine will antagonize that, or a long nap will do that. So those are the ways to explain in as simple terms as possible and not to use medical jargon, to explain to them what happens to our bodies during sleep and how some of the bad sleep hygiene habits can disrupt that sleep that is so important.
Mm-hmm. And how do you explain what happens long term if you have chronically had these habits?
Yeah. So especially that chronic sleep deprivation, right? Less about 5 to 6 hours, right? Long term, you're increasing your risk for diabetes. Okay. You're increasing your risk for high blood pressure. And very importantly, it promotes weight gain. And there are a lot of studies to kind of confirm that we know about, both epidemiological and in the lab. So we've got a lot of studies for that. So it really does impact your health long term.
Thank you. And what would you say is the extent that modifiable risk factors play a role in some of the conditions you treat in your specialty? So, is there a potential for me to intervene early through patient education because they're
Yes.
modifiable?
Yes, so the modifiable, the big one I would say is weight gain. Okay, that is really something that I think that especially you going into family medicine is we really, really need to work on that because it does promote a pretty serious sleep disorder called sleep apnea. But not only that, right? Weight gain, hypertension, diabetes, arthritis, right? A whole host of issues. So I think weight is a real modifiable risk factor, and getting adequate sleep is part of that also, right? So
Mm-hmm.
I think weight is a big part of that. The other thing that is insomnia, right? You're going to see a lot of patients with insomnia who are taking their worries to bed. So promoting good sleep hygiene and giving them tools on how to stop worrying about sleep, but also to take your worries away. Don't take them to bed. And if you do take them to bed, how to counteract it, right? So insomnia is another big one. So I think these are the kind of modifiable risk factors because insomnia, where people have problems falling asleep, staying asleep, or waking up too early, that in the long term, it is associated with depression. These are some of the modifiable risk factors, alcohol intake. It not only affects your health, it does also affect your sleep. So, not to say that you shouldn't have alcohol, but at least to curtail the amount that you have.
And so now the big question of this podcast is what could robust health in sleep medicine look like for your patients? So, what does it look like just beyond the absence of disease? So, what is exceptional, optimal sleep health? Does this apply to sleep medicine?
Yeah. So if somebody
Yeah.
says, you know what, I get 7 hours of sleep in a dark, quiet room, my temperature is low, I may have 1 or 2 brief awakenings, maybe to go to the bathroom, but I go back to sleep quickly. And not having any caffeine close to bed. I limit my alcohol to social drinking, maybe one or two drinks on the weekend. And I feel pretty good during the day, and I don't feel the need to take naps on a regular basis. I say, you're doing great.
Amazing. Thank you. What are some of the barriers you've seen that hinder patients from achieving health in your field?
The biggest barriers are, number one, I think to some extent is health education, health literacy. So I think what you're doing in terms of this podcast is very helpful for people to understand the importance of sleep, right? So I think that's the main one. But I think you can get past that by education. But then the others are their own lifestyle. What I find really disturbing, people are working two or three jobs just to make ends meet, or they have kids at home and they're working at the same time. So I think those are the big barriers, the social structures that we have in place that are really preventing people from getting optimal sleep.
So you touched the structural factors that play into this, and that kind of leads into my next question. So when we do patient counseling, we're working on preventive medicine at the individual level. What is your advice for how physicians can advocate for patients on the population level?
Well, that's a little bit tough, right? I mean,
It
we can
is.
advocate on an individual level, but on a population level, I think that what are we saying is that people don't have to work two or three jobs, right? Can we as physicians advocate for that, right? I'm not sure whether individually as physicians we can do it, but public health policy, right? People should
Right.
have to work two or three jobs to make ends meet, right? There
Mhm.
should be affordable childcare. So all these issues, having access to proper healthy food, living in safe neighborhoods. So those are the things that can promote on a public health level to promote optimal sleep, which is very important for health and for the,
Mhm.
I think, for the long term for society in general.
And for our closing questions, we go into this career to help people, and it's also as important for physicians themselves to take care of their own wellness. Is there anything you do in particular to maintain your own well being?
Yeah, I do. I always try to tell myself that I should practice what I preach, right? That's the important thing that we as physicians sometimes forget to do that. And so for me, I have a pretty straight routine. I have a bedtime routine. I mean, it sounds a little weird, but when I go to bed, I read for some time. Just before going to sleep, I do the New York Times mini crossword puzzle. It's my cue to go to sleep. I know it's activating, but we all need our own routine and our cues to go to sleep. I do it. It takes a couple of minutes because it's a mini, and I feel good. I turn off the lights. I make sure my dog is okay, and I go to sleep. And then I wake up at the same time in the morning. On the weekends, I may wake up half an hour, 45 minutes later than I normally wake up. But I give myself the opportunity to get 7 hours of sleep.
Neurology was saying the same thing about giving your brain cues and following a routine and training your brain. So I really appreciate that. And lastly, do you have any advice for medical students at all who might be listening to this, whether it's finding a
Yes,
specialty, any advice?
the way to get to medical students like yourself, because we just started a new year, is what I tell them, because that's your exams are very important to you guys, to us in this profession. I always say, get enough sleep because sleep is important
Mm-hmm.
for consolidating everything that you're reading before your exams into memory. That's how I get to that, because that's important, right? So don't stay up late at night before an exam. Make sure, because whatever you're reading, you're studying for your exam, it needs to be consolidated into memory, and you need your
Mm-hmm.
for that. So that's how I get to medical students.
Thank you. I appreciate the sleep medicine counseling of the med students. And lastly, if you had to choose a walk-up song to your clinic, for example, what would yours be and why?
Oh my God, that is a tough one for me. I'm not sure I can answer that one. Sorry, Michelle.
No, that's no problem. No
what,
problem at all.
what would you suggest
Oh,
for
for
sleep?
you or for sleep? Should it be calming maybe? Maybe some lo-fi beats.
Yeah,
I
yeah.
just
I don't think that the music that I like, which is 80s and 90s rock, I would use for my
yes.
sleep clinic, right? So I don't would be appropriate.
Oh no, well maybe only you can hear it. It's like your confidence, it could be confidence boosting into the clinic or it could be
Yeah,
getting into the zone.
yeah. So, I like you too. I like Queen.
Yeah.
Yeah, so those are my favorite bands. But I tell you what we do in clinic sometimes. We have a touchdown room where we are in my sleep center, we're all big Philly fans, right? So if they're
Mm-hmm.
playing a game in the afternoon, we might have the television turned on in the waiting room for that. And that also, if they're playing well, it helps us relax.
Thank
Yeah.
you so much, Dr. Grewal. I hope med students learn a lot from this and can teach patients what they learn from this. So thank you so much.
Thank you. Good luck to you, Michelle.